Good afternoon, everyone. I'd like to welcome everyone in the room as well as our audience members participating over the live feed today. I'm Maria Woolverton from ACF's Office of Planning, Research, and Evaluation. I'll be serving as your moderator today. This afternoon's session is focused on the use of evaluation tollgates in building evidence for social programs. Our presenters today are going to be discussing how we've approached the process of evidence building in the context of the development, implementation, and evaluation of interventions delivered through two different grant programs funded by the Children's Bureau within ACF. More broadly, a consensus is emerging on the importance of evidence building in the development of social programs. In many cases, including at ACF, federal grants have been awarded with the expectation that grantees will conduct evaluations of their programs. We often refer to these as local evaluations, but without a distinct planning phase to focus on building evaluation capacity or a mechanism for assessing whether grantees have the capacity to produce the types of evaluation studies and outcomes that we're looking for. Too often, grantees do not have these capacities, and their evaluations reveal no evidence of the anticipated outcomes of the interventions. Epstein and Clareman in 2013 argued that the premature movement to summative evaluation can be one explanation for the low success rate of evaluated interventions. Too many programs are subjected to summative evaluation when instead an intermediate step, testing the veracity of a logic model and implementing a formative evaluation, would allow funders to deem programs unlikely to show impacts and therefore not ready for rigorous evaluation. So Epstein and Clareman refer to such steps as evaluation tollgates. Two federal initiatives funded by ACF's Children's Bureau, the Permanency Innovations Initiative, which we refer to as PI in-house, and the Building Capacity to Evaluate Interventions for Youth and Young Adults with Child Welfare Involvement at Risk of Homelessness, which is a very big mouthful, and we refer to that initiative as YAR, or Youth at Risk of Homelessness. These two initiatives have used the tollgate approaches as a strategy to build evidence in child welfare. In both initiatives, technical assistance providers worked with grantees early in implementation to move programs along before subjecting them to formal assessment and looking at their readiness to move to the next phase of implementation or evaluation. So first, the Permanency Innovations Initiative, or PI, is a multi-site demonstration project designed to improve permanency outcomes for children in foster care who face the most serious barriers to permanency. This was launched in 2010 by the Children's Bureau, where they funded 6 grantees, a training and technical assistance provider, which we called PI TTAP, and an evaluation team, which we called PI ET. The Children's Bureau invested significant resources to combine rigorous evaluation and extensive support for program implementation. Each grantee in this demonstration initiative implemented a unique approach to their project, both in the populations they targeted and the interventions they developed or adapted. The YAR grantee initiative was launched kind of midway through the PI initiative, and so we had the benefit of learning what was going on in PI to structure this new YAR initiative. And when we launched that, we funded it as a multi-phase grant program to build the evidence base on what works to prevent homelessness among youth and young adults who've been involved with the child welfare system. So currently, there's very little evidence on how to meet the needs of this population. So we really were kind of trying to develop an evidence base from scratch, and I think a lot of what you're going to hear today really reflects kind of like what we're learning about how to do that in the field with grant programs. So in the first phase of YAR, 18 organizations received funding for this 2-year planning grants, which were funded from 2013 to 2015. And then 6 of those organizations received funding for a second phase of YAR, a 3-year initial implementation grant from 2015 to 2018. During the planning phase, grantees conducted data analyses to help them understand their local population and develop a comprehensive service model to improve outcomes in housing, education, training, and social well-being, and permanent connections. During the initial implementation phase, grantees are refining and testing their comprehensive service models. And they'll be conducting usability testing to determine the feasibility of specific elements of the model and conduct formative evaluations to understand what supports and structure are needed to implement the model with fidelity. Finally, they will develop a plan to test their comprehensive service model in a summative evaluation if we are to fund a phase 3 of YAR in the future. So our first two speakers today are going to discuss the approach we took in PI, as well as findings from the cross-site implementation study that we fielded at the same time as the PI grants were funded, and they're going to talk about the approach to the evidence-building process in PI. And then our third speaker is going to discuss the ongoing work with YAR grantees. Before I introduce our three speakers, I just want to remind everyone that the PowerPoint presentations can be requested by sending an email to recs@impactint.com. Is that right? And then also, we're going to have an extended Q&A session at the end after all of the speakers, so if you're able to hold major questions until the end, we'll have time to do that. So our first speaker today is George Gabel. George is a Westat Senior Study Director with more than 25 years of experience in child welfare research, including multiple Title IV-E waiver evaluations. George is the project director for OPRE's evaluation of the PI initiative, and he's familiar with child welfare administration at the state and local levels, having worked for 6 years as director of management and analysis of New York City's Administration for Children's Services. And our second speaker is Heidi Melz, who's a senior research associate at James Bell Associates. She has 15 years of research experience focusing on interventions that address child welfare and family structure, functioning, and well-being. And she works in the child welfare practice arena at James Bell on the evaluation of the Capacity Building Collaborative, a 5-year evaluation that studies the effectiveness of training and technical assistance in building capacity in child welfare organizations. And she's also led the cross-site implementation study for the Permanency Innovations Initiative. And our third speaker is MC, or Kay Bradley, as we call her. She's a senior researcher at Mathematica Policy Research and an expert on designing evaluations of services for at-risk youth, including teenage pregnancy prevention programs, and in conducting process evaluations of both education and community settings. She currently serves as a deputy project director for the YAR contracts, and she led a process study of the planning phase of YAR, and she currently oversees evaluation technical assistance and supports the process study for the initial implementation phase that is going on right now. Kay also leads evaluation technical assistance for local evaluations of teen pregnancy prevention programs and the performance partnership pilots for disconnected youth national evaluation. So with that, I will turn it over to George for our first presentation.
Good afternoon, everyone. So my colleague reminded me that perhaps not everyone got the reference to Gondorff, but if you and hopefully you do recognize it from Lord of the Rings, but we are also reminded that as a result of trying to stop the creature on the bridge, he died, but I do want to remind you he came back in the second movie even stronger, but with, of course, white hair. So for those project directors and evaluators in the room, I hope that you can deal with that reference. So, and thank you, Maria, and others from OPRE who have supported the PI project all these years, and Matt McGuire from the Children's Bureau, who is a sort of lead project officer for the grantees and the technical assistance. My goal today is, I'm going to give you, and I'm going to catch up on the slides. My goal today is to give you an overview of our PI approach, and then to talk a little bit about what we learned sort of after from the formative process, sort of some of the lessons learned. Heidi Melz is going to follow me and talk a little more specifically about some of the implementation issues, particularly through what she learned through case studies. I'm going to use this org chart just to sort of give you a sense of the number of players that were involved in this project. First, our clients, the Children's Bureau on the left. Their active participation, of course, their conception of it, they're guiding the grants, they're guiding the technical assistance, and as Maria mentioned, TTAP was the partner on that, led by JBS International with the Center for the Support of Families, as well as the NERN, National Implementation Research Network out of the University of North Carolina. On the evaluation side, and of course, I'm sorry, down at the lower left corner are our grantees. I'm not sure you can see them. I'll read them. Arizona, California, Illinois, Kansas, the Los Angeles Gay and Lesbian Center, and Washoe County, Nevada. And on the right side, the evaluation side, Maria, of course, is our project officer, and our ET, our evaluation team, included Westat, James Bell Associates, the University, UNC School of Social Work. Mark Testa, many of you have worked with, was our principal investigator. Ronna Cook, Andy Barkley, and Courtney Harrison, who did some work on dissemination. Oops. This is where we started, and you'll see, for those of you that are familiar with some of the NERN work, you'll see some of it present, but this is really how our conversation started. Again, our goal to bring implementation and evaluation together. Whoops, there we go. How do we, well, obviously we all agreed we've got to improve the outcomes for children. And what do you need to do that? You need a what? A strong intervention validity. And you need a how? A strong implementation integrity. Easy start, a complicated implementation for us about how to get them to work together. I'm going to come back to this a little bit later because actually, during the years we were working on the project, the formula got a little more complicated, and I'm going to come back to that at the very end. And I want to show you sort of what that led to, which was our PI approach. The PI approach is a phased model of increasingly generalizable studies, which integrates rigorous evaluation design and implementation science to build evidence-supported interventions that can be implemented with optimal integrity for evidence-based practices and broad-scale rollout to improve family permanence. So hopefully you can see this. On the left, this pyramid took quite a bit to get agreement on, so we're pretty proud of it. On the left side, you'll see the sort of the reflection of the NERN model, starting with exploration and installation, working your way up through initial implementation to full implementation. The PI stopped at that point, but beyond that is replication and adaptation and broad-scale rollout. On the right side, running along in parallel and hopefully integrated, is also the exploration and installation, and I'm going to talk more about how the evaluation performed that, leading to formative evaluation and then summative evaluation. Sorry. During the period, I'm now jumping to the evaluation. During the initial period of exploration and installation, we spent a lot of time working with grantees to identify the target population using a lot of different methods of data mining. We conducted research reviews, developed theories of change, along with the grantees and TTAP, as well as the logic models for our evaluation plans. During this period, 4 evaluation templates were completed: population, intervention, and a comparison and an outcomes template, Pico, P-I-C-O. Each phase had Tollgates with intensive review and approval involving the whole team. Process required the integration of implementation lens and evaluation lens on every programmatic decision. One thing, if we were able to redraw this pyramid, of course, it's been one of the foundations of our work. I would make the bottom layer much wider, because what we learned is it takes a lot longer to do that exploration and installation work. During the formative period, so just jumping up, Jumping up during the formative period, instruments, procedures, interventions were tested on a small number of cases. That was on the evaluation side. On the implementation side, the TTAP team was also doing usability testing on all the important components of the program, of the intervention. During that period, we conducted formal formative review process to confirm that the intervention and the evaluation were heading in the right direction. For summative, going up to the next box, and 3 programs sort of reached summative, 3 of our original 6. They were approved to conduct summative evaluations with RCTs, Illinois, Washoe, and Kansas. The other 2 sites that were building interventions from the ground up continued at that point with phase 2 formative evaluations with continued development, and their final reports actually are summaries of their formative lessons learned. And that's both the RISE in Los Angeles and the CAP in California. The 6th project, the Arizona, actually dropped out at the beginning of formative due to some contextual issues. There was a lot going on at the time in the state, and the rigorous requirements of the project just turned out to be too much for them. I mentioned the Pico, and this was an important driver for us from work done by Mark Testa and John Portner in their Fostering Accountability textbook. Pico is a framework which guides most of our evaluation work. By designing a well-built research question, the core components of the evaluation become clear. Pico provided a common approach and actually a terminology. It was quite impressive to hear a lot of our grantees using all of our words that we created in their work. By emphasizing that a complete evaluation needs all 4 components, the Pico approach guided the grantees in developing well-built research questions and guided the evaluation work. For example, for the population, without an understanding of the population to be served, grantees couldn't select an appropriate intervention. We had them go through that process. Pico helped the evaluation team, the grantees, and the TTAP understand in those sites' population who was most at risk and therefore who would benefit most from the intervention, and of course from the evaluation side, where could we best see the change. Data mining was an essential component of determining the population, and these decisions were made in that first layer of the pyramid. I'm just going to jump over this. Really, it was just to remind you that we did develop a number of templates for this, and they are available for folks that are interested by just contacting us. This is where we ended up after the data mining. And after actually the implementation and exploration phases. I'm just going to go over these quickly because I do want to get to my slides on more on the formative. But here's where our Pico ended up. After data mining and other exploration activities, sites ended up targeting these populations. For some, the data mining confirmed what they proposed originally, but for others, they had to make some adjustments. So let's get to some of the Tollgates. So going from the exploration phase, you can see the first decision. If they had come up with a draft manual, if they were able to manualize what their intervention was, they were able to, yes, move forward. They then conducted their usability testing, and if they were able to show that their intervention and all their procedures were stable, yes, they could move forward. If not, they had to go back and continue the usability testing. They would then move forward to the formative testing, and this was done on a small sample, and if we were able to show, again, working closely with the grantee and TTAP, that there was an association between the outcomes and outputs they selected for the formative, then they were able to move forward to the summative. Okay, how did we use the formative process? I probably should say really some of the things we considered sort of in making decisions around the formative process. First, just a reminder that of the 6 programs, 2 were adapted programs from other fields, 2 were new programs, and 2 were combined interventions. So the project decided to put a lot of structure and time into the Tollgates for the formative. Remember, we are now about 2 years, a little bit more into the PI study period, trying to watch that 5-year clock so that we could finish with summative. So we had to make decisions with grantees and the technical assistants really around time. What could we look at? How long could the period be for study? Working with the grantees and the implementation team, we used the theory of change and the logic models to decide on criteria for the formative studies. So first, the time limited. By this, I mean we had to identify outputs or outcomes that would see change within a short formative period. We obviously wanted to see the results of the formative before we sort of agreed to go forward with the summative. In some cases, we had to make changes. We wanted to be sure we had enough sample left for the summative. So if we changed the intervention, we could not use that original sample. So we also had to make sure that we used a small sample, but we wanted it large enough to at least see the association. Again, in collaboration with the grantee and the technical assistants, we did not use all the outputs and all the outcomes for the formative. Did not use them all from the logic model. We selected a few that we felt were important to see some change. When did we raise the toll gate? Most importantly, were things happening as expected was sort of our guidance. We used a low threshold for significant testing for the selected outcomes. We wanted to be sure that things were moving in the right direction, but did not have large enough samples to really let that determine that things were if there was no difference, that was adequate in most cases. If things were not moving in the right direction, the partners with the grantee, we wanted to We used this opportunity to really look at the risks of change. While we had already done some usability testing around the RCT procedures, we also used the formative to really test out the procedures. And the formative period was a good opportunity for that, to see that the flow was working correctly, and we had to make some changes for that. So let me just jump on to a couple implications that we would recommend for future replications of this. Some trials might not pass, and I think it's real important that you prepare the stakeholders at the very beginning. Of course, there's always turnover in stakeholders and staff, but it's important to really lay out to folks that they're sort of not every program is going to go forward. We also saw the need for as much usability testing as possible. It's just important to test out every piece of the implementation and the evaluation. Again, that's a feature of the clock. How much time do you have? Also, obviously, one of the worst outcomes, and this did not happen for us, but you might have to stop the train. Maybe things can't proceed, and of course, that would be if you saw some unintended consequences. All right, let me just jump back. I promised I wanted to just come back to this slide. Let me get them up there. Oop. By the end of the program, of the project, we, as well as NERN, had added the fourth box, the where, to their slide. That it's not enough with the what and the how. You need the where about the context before being sure that things are going to work. Okay, I'm going to stop there, and I'll hopefully have time for questions. And here's some context. And I'm going to turn it over to Heidi, who's going to talk a little further about PI from a case study perspective.
George is taller than me. So I think you heard George talk about the toll gate idea, raising and lowering the toll gate. It really brings to mind this idea of there being sort of a highway, a road, things are moving forward, and using kind of that same metaphor, the cars that get there are going at different speeds. And so I want to use an example from one of the PI sites. This was the California project. This project's name is the California Partners for Permanency project. They developed an innovative casework model, the child and family practice model, that was intended to really rethink the way services were delivered by frontline staff to children and families, with the intention of reducing long-term foster care, improving permanency outcomes among children in the state, particularly among African American and American Indian children who are disproportionately represented in their system. CAP, as we call it, was one of the projects that did not move forward through the toll gate between formative to summative. And so in this presentation, I want to talk to you a little bit about what we learned from a case study we conducted of CAP, as we did with all the PI sites, what we learned about the program's implementation and evaluation trajectory, and what were some of the facilitators and really barriers that that affected that trajectory, that movement, the speed with which they went down the highway and ultimately arrived at the toll gate, and why they didn't go through. So the implementation study that we conducted of PI included case studies that were designed to collect information on the project experiences of the grantees as they applied the PI approach that George just described. The data for these project case studies came from program materials, documentation that we collected, and also from project staff informants. So the way this worked was the evaluators collected these data and used it to complete an 11-page protocol that we used for each project that documented 54 individual activities in implementation and evaluation across the 4 phases of the project. And these were the phases that we were interested in exploration, installation, initial implementation, which is when we conducted formative evaluation, and full implementation, which, where it applied, we did the summative evaluation. Here's just an example of what this case study protocol looked like, and I want to share it with you because I want to encourage you to consider the use of case study to really put some context around outcome studies. So this is how we did it. Like I said, we had 54 individual activities. They were things like what you see here, like develop program referral procedures and policies, or build a collaborative governance structure. And then, so there are 54 of those, and for each of those, the evaluators, there was, a site lead for each site, completed this sort of information. The date work started and ended on that. Who were the people within the organization, the grantee organization, who were responsible for these activities? What were the different levels of communication or decision-making involved? What kind of products resulted from the activities, and what kind of challenges and facilitators were there? So really deep information on each of these activities. And what we did with that information was to certainly use, a qualitative analysis approach, in a nutshell, but use the findings from it, the sort of themes that we pulled from it, to build and refine these case study narratives, but also to build these implementation timelines. And this is just an example of, we had many different versions of this at different levels of detail for each site. This is from CAP, and it shows essentially how long it took them to get through each of the phases. And the reason that this was important is that it gives us a sense of how quickly grantees are moving through the phases, the differences between grantees in how quickly they're getting through the phases of implementation. And it allows us to see where things go really smoothly and perhaps quickly, and places where grantees get hung up. And so from the case studies, we really got a very clear sense of some things that, that help determine whether and how quickly a grantee reaches that evaluation toll gate between formative and summative evaluation. And so I'll just use CAP as the example. There were 4 main factors that we found really influenced this trajectory and really helped determine whether grantees made it through the toll gate from summative to formative to summative. So they were grantee characteristics, the choice of the intervention that they were implementing, the development of training and coaching on their model, and staff turnover. So first factor was grantee characteristics. So these are things like the child welfare context, the governance structures within the grantee organization and specifically the project itself, and things like organizational readiness to take on this kind of work. These were all factors in the transition from formative to summative. So for example, in the case of California, California is a county-administered child welfare system, large state, lots of counties, and the intervention was being implemented in in several counties. It also, as I mentioned, has a large, disproportionately large child welfare, minority child welfare population. And so what that means is there's a lot of people that need to come to the table. There are, at the very least, the different county agencies, also community organizations representing the interests and perspectives of the African American children and American Indian children and families whose well-being was going to be impacted by the changes that CAP wanted to make. When you have that many people at the table, clearly there's usually a much slower, more deliberative process, which is not necessarily a negative. The good thing is you're getting diverse opinions and perspectives on the changes that you're proposing, but it certainly means a lot more meetings. It takes a lot more time to build consensus. And then also organizational readiness. CAP was not unlike a lot of child welfare systems in that the agency, the California Department of Social Services, measured low on things like agency flexibility and ability to respond quickly to change, which is, not an unfamiliar concept for most of you for the work that you do. So these factors, of course, can slow down movement towards summative evaluation. Okay, so the second factor was the choice of intervention. So the decision about whether to take on an existing intervention, like an evidence-based model that maybe has a purveyor and a lot of materials already developed, versus creating something that is practice-informed but innovative, it has a big effect on the transition from formative to summative within a particular time frame. It really affects how quickly a program moves through its initial phases of implementation. There are few evidence-based interventions that are appropriate for reducing long-term foster care, specifically within child welfare, but there are a few that are appropriate for child welfare in general. So most of the PI grantees were faced with either adapting a model from a different type of system, maybe from mental health or something that hadn't been used in child welfare population specifically, or building something from the ground up. California decided that for the particular problems that they were facing, the changes that they wanted to see, and the particular populations that they were targeting, that nothing that was out there was going to do it for them, and that building a new model, a new practice model from the ground up was what was right for them. And so they went into this knowing that that means building everything from scratch. So they did it because they felt it was the right thing for them, but that means that from the very beginning you're going into this knowing that there's a lot of initial startup time that you're going to need to build into your trajectory. So that decision we found really affects how quickly you can get to the toll gate. Factor 3 is development of training and coaching. Grantees who made the transition to summative from formative had developed their training and coaching processes very early in their implementation. That was a very clear association. So there is the training on the model to begin with. The fact that you are implementing an innovative practice means that the training is not out of the box from a purveyor. You have to develop that to begin with, then get everyone trained, get your coaches trained in coaching so that they can really help the training adhere. So all of that takes a long time. But then on top of it, you want to be doing fidelity monitoring to see if the training is working and your frontline folks are delivering the model as intended. So we found that, in fact, within CAP, the fidelity monitoring was not really robust. There were some counties that were doing it really extensively and well, and others that were having a harder time making sure that all of their frontline staff who had been trained were also being assessed for fidelity to the model. So you want to know that you have a staff that is trained, that are being coached, and that are delivering the model with acceptable and increasing level of fidelity before you move on through the evaluation toll gate. And so that was one of the things that affected the fact that CAP did not move on. And then finally, and relatedly, staff turnover. So staff turnover was, as it is across child welfare, a real challenge for California. And it is one of the things that affects movement toward the toll gate, because high staff turnover really undermines the work that you're trying to accomplish in training and coaching in the first place. When you invest your resources to get frontline staff trained and coached, and then you lose them, you are starting all over again when you hire their replacement. So high caseloads for the frontline staff to begin with, and then high turnover necessitates really almost constant training and retraining. And for CAP, that really undermined their ability to move forward to summative. So in conclusion, the trajectory of movement to the toll gate and getting through the toll gate really is affected by these four sort of characteristics of program implementation, and they are all things that get established really early in the project. So you can tell really early, once you understand this, which will be the grantees that are likely to have a harder time getting through the toll gate, or getting to the toll gate, within the number of project years that you have. So efforts to bolster these sorts of factors really early on are a good investment in time. Also, from a methodological perspective, we just found that the use of a case study really helped us to see this, to understand it, to make sense of why some grantees moved through the toll gate and others didn't, and to understand better next time what could be done to provide implementation supports very early on where you think that they'll be needed for some of these. CAP didn't transition to summative evaluation really because there was still a lot of work to be done to refine and test key aspects of their model, to deal with their staff turnover, and to get to a point where fidelity monitoring was really across the different counties and being done consistently and well. And that's okay. I think that really the most important story that needs to be told here is that not moving through the evaluation toll gate when it's not warranted is a good thing. It's the appropriate thing. And so the use of the evaluation toll gate really gives you a chance to sort of stop and make a very clear assessment between the evaluators and the program staff about whether the program really is ready to move on to summative evaluation, or whether it's better to stay on this side of the toll gate and do more work on implementation. Okay, thanks.
So many of you know me, and you know that I used to be a teacher, which means I'm used to projecting my voice. So I'm I'm not used to mics, so hopefully it'll just be okay. So good afternoon, everybody. I'm looking forward to sharing with you all some work that we are still doing with YAR. We have been able to build off of Pi, and some of the lessons that they learned shaped the work of YAR. And so that's a great place to be, to have somebody out in front of you. So thank you both very much for leading the way and giving us more time. As Maria said, we just call this Project YAR because its real title is way too long. So YAR stands for Youth at Risk of Homelessness. We're talking specifically about youth and young adults at risk of homelessness who have child welfare histories. So that means they're currently in care, they are about to transition out of care, or they have been in care, perhaps even been adopted as infants, and are now experiencing homelessness. So there's sort of three populations that we talk about. There are a lot of people who are a part of this work. Our colleagues at OPRE and the Children's Bureau, my colleagues at Mathematica, and of course the YAR grantees themselves. So we're going to learn a lot from all of those people. So today I'm going to give you a brief introduction to YAR, which is just kind of the overall project, and then I'll talk specifically about YAR 1, which, as Maria said, was in place between 2013 and 2015. During this time, grantees were doing planning work. We have released products related to their planning work, and you can find them on the OPRE's website, and the link is here. The truth is that if you Google building capacity and youth at risk, you'll find the link pretty easily. And then I'll talk a little bit about YAR 2 and what we're doing with YAR 2, which is currently going on. So YAR is really at the intersection of child welfare and homelessness. As you know, there's a big concern about youth homelessness. How does being at risk for homelessness differ by age and by characteristics? And in particular, the United States Interagency Council on Homelessness, or USICH, was really thinking about what are those characteristics that are going to affect homelessness, the risk of homelessness for youth. And one of the characteristics they were interested in is foster care history. As Maria said, YAR is a multi-phase grant program. You can think of these phases as formal toll gates that the grantees go through. So in phase 1, 18 communities received funding. The communities were provided 2 years and up to $360,000 per year to identify 3 target populations in their community, learn the needs of each population so as to prevent future homelessness, and develop a comprehensive service model that would meet those needs and thus prevent future homelessness. Phase 2 funded 6 of the 18 phase 1 communities for an additional, originally 3, now 4 years, and they receive up to $670,000 per year. The grantees have entered the 3rd year of phase 2, and just received word that they can request additional funds and time, extending phase 2 to 4 years. During phase 2, the focus is on the initial implementation of the comprehensive service model. They've worked to refine their comprehensive service models by developing well-articulated theories of change and logic models. They're also being asked to identify and describe possible comparison conditions for a summative evaluation. And in refining their comprehensive service model, they are also doing usability tests. And grantees are moving into conducting formative evaluations to learn whether the comprehensive service model can be implemented as intended in their community. It's not yet known whether phase 3 will be funded. If funded, a summative evaluation will be conducted to determine the effectiveness of the comprehensive service models developed in phases 1 and 2. All right, so this is a map of the United States, and all of you should recognize it. It has colored squares and triangles in 16 states, which identify the child welfare agencies or similar organizations that have received YAR 1 or YAR 1 and YAR 2 grants. As indicated by green squares, 4 states, Nevada, Oklahoma, Minnesota, and Wisconsin, have state child welfare agencies that received YAR 1 grants. The green circles in Northern California, Pennsylvania, Montana, and Florida indicate county or tribal child welfare agencies that received YAR 1 grants. And the green triangles in Washington, Illinois, Louisiana, and Texas represent the community-based organizations that received YAR1 grants. There are 2 states with blue squares, Colorado and New Jersey, and I'm sure you all have figured out, these are the state child welfare agencies that received both YAR1 and YAR2 grants. The circles in Southern California, it's actually Central California and New York, have county or tribal child welfare agencies that received YAR1 and YAR2 grants. And finally, the blue triangles in Ohio and Maryland indicate the community-based organizations that received both YAR1 and YAR2 grants. All right. So as a part of YAR1, we conducted a process study, which you can find on the OPRE website, and I'm going to share with you some of the findings from that process study. But to remind you, the YAR1 planning grants had a very long name. 18 were funded by the Children's Bureau, and they had a 24-month planning period. Their charge was to develop an intervention or a comprehensive service model to prevent homelessness among youth and young adults with child welfare involvement. They began with data analyses to understand the size of the at-risk population and the risk factors in their own sites. This is the first national effort to implement the USICH Youth Data Strategy for an at-risk population. So this slide is a table from the process study report, and I'm going to take a moment to orient you to it before I talk about it. This shows the timing of the work, and it's very reminiscent of Heidi's timeline slide, although we've got all 18 grantees in one slide. So on the left side are the 12 activities that the Children's Bureau communicated to grantees as activities that form the foundation of the planning period work. Let's go to the top row for a second. And it reads, perform data analysis to define and refine the target population. You're going to have to trust me on that because I know the font is a little small, but that's really what it says. This is a logical first step if you think about their planning grants, right? You need to understand who it is you're planning something for. Looking at the dark blue boxes to the right of the task, we see that initially the Children's Bureau thought grantees would complete this work within the first 2 quarters of the planning period. So that's what the 2 very dark boxes are. If you stay on that first activity but go below those dark boxes to the multicolored blue boxes, you can see that at least one grantee was working on their data analysis as early as Q1, and that the last grantee started the work on their data analysis between quarters 5 and 6. So there's a big gap between people who were working on it. For the most part, the activities are sequential. If you look at the dark blue boxes, they move along in time. However, if you look at the other bar, which reflects where the 18 grantees were actually doing the work, you'll see that at least one grantee reported working on every activity every quarter. And you can also see that many grantees started activities after the CB anticipated they would have been completed. Remember that first row we looked at? So this graph helps illustrate that things don't always happen as anticipated, and there are lots of reasons why this happened. There was more red tape in some communities, there was more time needed to hire staff, activities became iterative in a way that wasn't anticipated, and expecting the grantees to complete the same activities we found was reasonable, but they can't all do it on the same timeline. All right. As you know from the map, there are 3 types of lead agencies in YAR. There's state child welfare agencies, there are county or tribal child welfare agencies, and they're community-based or non-governmental organizations. When we were out doing the process study and looking at things, we began to realize that the type of lead agency was actually affecting the activities being done. It affected the partnerships and relationships the grantees developed. It affected their staffing. It affected their ability to work with data. And it also affected their proposed comprehensive service model. I'm only going to talk about 2 of these today in the interest of time, but you can go read the process study, or they're short little things that tell you a little bit about all of them. So partnerships shaped grantees' progress, and the partnerships were also shaped by the type of agency. But one grantee described that this was the largest group of stakeholders they had ever gathered together in the state. Another grantee said, we were having a rough time. There are a lot of people out there trying to work with the Child Welfare Agency at the same time we were. And I just had to keep showing up and listening and doing what I said I would do. So who they were, their relationship with the Child Welfare Agency really shaped how they could do. For data access and quality, grantees really struggled with data access, even if they were the Child Welfare Agency. One agency took more than 9 months to get a data sharing agreement in place. And remember, I showed you that grantee who didn't start their data analysis until Q5. Even with the data in hand, sometimes they found the data didn't actually have what they wanted or what they expected. So one grantee here talks about the fact that they were serving 900 youth, but that wasn't what was in their data system. So moving on to YAR 2, this is ongoing. We're in the throes of this with our grantees. There's 6 grantees. They were all YAR 1 grantees, so they went through that first formal toll gate and were awarded a second grant. They had a 36-month implementation period, which, as I said, was extended to 48 months recently. And they are supposed to be refining and initially implementing their interventions and conducting a formative evaluation. One of the big differences is that in YAR 2, we're giving a lot of one-on-one evaluation technical assistance. I call myself their critical friend. They don't always like me, but I'm there to help them as best I can. We have calls at least monthly, and we also have in-person working meetings. So they're getting pretty intensive evaluation technical assistance. They have to complete 5 templates, which are toll gates, much like what George talked about, a theory of change, a logic model, the Pico, so there's the population intervention comparison and outcomes, usability testing and findings, and a formative evaluation. We're also providing webinars and structured peer learning experiences to support them in this work. So they've shared their theories of change with each other and other things as well. As a part of this work, both in YAR 1 and YAR 2, we've identified some common challenges that we wanted to share with you. Most of you will be like, this isn't really new and exciting, but we thought it was kind of cool, so we wanted to share it with you. So the first one is, not everyone's gonna worry about the same things or articulate their worries in the same way. So participants, grantees, their evaluators, funders, and the TA providers come with their own perspectives, concerns, and language. One person's nuances may not be grasped by another person in conversations, which can result in frustration and additional problems later in the process. We've found that it's important to create space for conversation and to take time to speak clearly, describe the concerns and the reason for it, and to be open to broad discussions about how to address the concerns. The TA liaisons spend a lot of time stopping a conversation and making sure everybody's on the same page. And the nice thing is the grantees and the local evaluators have started doing that as well. A second challenge that we've had is balancing the need or the desire to serve everyone immediately and preparing for an evaluation. Often ACF grantees are experienced service providers who are eager to serve their population. They want to make lives better for the youth. Evaluators may also be eager to start their evaluation before a program has defined its outcomes, identified the data sources, and ensured that services are being provided as intended. The enthusiasm may inadvertently result in evaluating a still evolving program or not having consistent and reliable data. To address this challenge, you have to clearly articulate that rigorous evaluation is the only way we learn whether an intervention achieves the intended outcomes, and that it takes a lot of preparation to be ready. We've had to have conversations with people to acknowledge their perspective and help them understand what we're trying to accomplish. Building evidence, it can be a long and iterative process. And it's not quite as easy as many people believe. Proving that an intervention works takes time and effort, and depending where the grantees start, they may still be working out the kinks of an intervention. And even once the kinks are worked out, it may be that the intervention still can't be implemented in that community quite the way they had intended. Communities differ in their experience with and tolerance for rigorous evaluations, particularly the concept of random assignment, and changes in the intervention may be required to secure a community's willingness to participate. Funders can help address this challenge by developing expectations, requirements, and supports that help grantees work from their own starting point. And this is a lot of what YAR has been trying to do, and we've been building off what the PI grantees learned and told us. Grantees can prepare their stakeholders for this slow and process, and boy, has this taken a long time to get everybody on the same page and to move at the right pace for each grantee. And for more information, you should feel free to reach out to Catherine Heath, who's our project officer at Children's Bureau, Mary, who's our OPRE project officer because Maria left us, and Matt Stagner, who's the Mathematica project director.
I want to thank all of our presenters. As Kay said, this work we've talked about today has been going on since 2010, so I think you have a sense of kind of how long it takes to build evidence from the ground up, particularly in child welfare settings where we haven't had a lot of evidence-based interventions for particularly the populations that we've been trying to develop them for. So I think we should have about 15 minutes for questions. And are there microphones in the room to pass around? Okay. Questions? Anyone want to grab a mic? And could you identify your name and where you're from?
Yeah. Hi, I'm Alex Antrim from Kingsley House in New Orleans, Louisiana. We're a Head Start agency, and I'm our manager of assessment data and research for the agency. And so while we're not a grant, I mean, we are a grantor, but in a way also we aren't a grantor. We have a lot of our own program design that we go through. And I was kind of wondering, because I'm a part of that process, especially as the evaluation and assessment lead for a lot of the projects, I was wondering how this process could possibly be used for like A/B testing, if that makes any sense, where you have multiple ideas kind of going at the same time to address the same issue, and then possibly after like the formative evaluation process, pick the better solution to the issue, if that makes any sense.
Okay, are any of the YAR grantees doing that type of thing?
None of the YAR all of the YAR grantees have chosen a single intervention at this point in time. So I don't have anything to add to help you, I'm sorry, from the YAR experience.
Okay.
But I think from PI, part of what we were doing with the formative evaluation is not just evaluating the intervention itself, but also evaluating the evaluation approach. And so that's where I think it may apply, in that during the Tollgate process where, and we really didn't describe this too much, but we essentially all came together and looked at the data that we had from formative evaluation before moving to summative evaluation for grantees that did, to make sense of whether short-term outcomes were trending in the right direction. But we also were looking at the instruments that we were using. Like if we're not seeing outcomes are moving in the direction we expected, is that because there's something wrong with the integrity of the intervention, or maybe is there something wrong with the instruments that we're using, and they're just not they're not capturing the improvements that actually are happening. So I think this process works well for what you're describing, because it gives you a chance to assess sort of comprehensively an approach that you're taking, or can be used to assess multiple approaches at once before you then set things in stone at the summative evaluation. So yeah, because the stakes are lower at the formative phase. The investment is not it doesn't take, formative evaluation doesn't take as long as a summative evaluation. Your sample size is smaller. You're not putting necessarily much stock into statistical significance, or you're being really lenient with it. And so all of that gives you a chance to say, let's just take a look at what we know and whether we're confident about what we know, meaning whether our instruments are working, before we really, go full speed ahead with a bigger investment in summative.
Absolutely.
I think
Sorry, go ahead.
I was just going to say, I think, to me, it starts all the way back at the data mining and the exploration, because some of the grantees came in with, you sound like you have lots of ideas, came in with lots of ideas, and then looking in the data mining, we really looked to see, probably the wrong expression, but which got the best bang for the buck. Where is it worth investing your time, because the risk is highest for these kids. So that really led to some good conversations about, well, maybe you should start here. This is the population and this is the issue that's of highest risk.
So the other way to think of A/B testing is usability testing. And so doing very short, very targeted tests. And the YAR grantees have been doing usability testing. And so, for example, they looked at whether or not having their group sessions always in the same location actually was working. And what they discovered was lots of the kids weren't coming to sessions. And when they started going back and talking to them about, why aren't you coming to group sessions? The youth were like, it's on the other side of the county. Like, why am I going over there? And so that was one of the things that this grantee learned very quickly. So it's not different versions that they were necessarily testing, but then they put it in 2 different locations and looked at attendance rates, and attendance rates were better. So we did that. They have been doing that kind of work.
Okay. Thank you very much.
Yep.
Other questions?
Hi, Erica Zalewski with the Office of Management and Budget. I'd love to hear a little bit more about the data challenges. I find it very interesting that even when the agencies had the data themselves, they still had some maybe issues or challenges kind of using it. So could you guys say a little bit more about that?
And I'm going to out Erica as one of the original people involved in YAR when we first started it.
Yeah. Do you want to go first?
No, go ahead.
So data challenges took many, many different forms. And in some cases, they were relying on the SACWA system. And as any of you in the room who work with SACWA systems or work in child welfare, you know that those are a little old and they're not quite as nimble as you would like them to be. So one of the grantees, the grantee was the child welfare agency, and they literally could not get the data out of the SACWA system that they wanted because they had to get only those reports that had been pre-programmed, and those reports didn't give them the data they were looking for. For our grantees who were not the child welfare agency, and in YAR 1 there were 6 of them, you were talking about needing to try to negotiate data sharing, child welfare data going into another organization, and that was complicated. We had one grantee who actually figured out that if they were providing services, then the child welfare agency would share data with them on the youth that they were providing services for. And so they very deliberately went out and started providing group services for homeless youth who had child welfare histories and for youth and things like that. And that way they were able to develop that partnership with the child welfare agency and were able to get that kind of data. But it took them a little bit, and it was simply because the lawyer made an offhand statement about, well, if you were serving the youth, and the grantee was fast enough to figure out that was the way to get them. So yeah, it just depended.
Almost the same issue, the expression, it doesn't count if you can't count it. I mean, some of our grantees were working, trying to develop programs for LGBTQ youth, and it's not in the SACWA system. We're not getting there. As you know, it's been delayed, at least part of it. Even race ethnicity data is not always so good in some of these older systems because of the sort of the layers over time about how those definitions have changed. So that obviously, how do you focus programs on a population you can't identify? So that was a challenge. And then even I guess these are all the same issues. So you want to work with youth with severe emotional disturbance. Well, that data are not very good in some of the systems either. So they had to go to other sources. For some of our data mining, we did grantees or the evaluators with the grantees did do case record reviews to just try to dig into that data a little bit better. because the system, the administrative data system wasn't adequate.
Yeah, and I think, all of that, certainly, like I said, these are very early on things that you come across. Data mining and deciding what your target population is something that should be done very early in the process. But it's not as simple as just saying, go in and look at your data. And so a lot of these challenges are things that happen very early on, and right from the start then, you're already sort of behind what you had hoped progress toward full implementation would be. But it's, so, in terms of planning, absolutely projects have to plan for the idea that anything related to the data, making sense of what's already there or collecting and making sense of new data is going to take much longer than you hope or expect that it will, and that should be factored in. We have no good news for you.
I would encourage, I know I'm off mic, but I would encourage you to write up your experiences and think about briefs or other formats to sort of disseminate kind of lessons learned.
So
Oh, yeah.
there are several briefs on the data experiences in both Pi and YAR on specifically addressing the data issues on the UPRE website. And I think one of the other things we were trying to think about from a federal agency is what would we want to know when we fund new grantees about data capacity going in, and can we write funding announcements to try to elicit some of, to determine whether those capacities exist within the applicants. Other questions? Anybody, do we have any from the live stream? Anyone else?
Hi, my name's Katrina Bruce. I'm with the Annie Casey Foundation. And so I'm just thinking from the funder perspective, and you're going in and trying to evaluate, everyone wants these summative evaluations, and there's definitely a place for these toll gates, because if you're not doing with fidelity, you're not evaluating anything. So what advice do you have for funders in helping us work with the grantees that we want, that we say you have this great promising practice, and helping them move through these toll gates?
Well, one, I think just establishing a toll gates, because it's not really something we did before these grant projects. So trying to figure out, kind of establish what those are. And part of the way YAR got established as a multi-phase grant process was because of our experience with Pi, trying to do that within a 5-year single grant, which obviously we learned if you're building building a new intervention from scratch is a very short time window. So we explicitly tried a new approach with YAR, which was the multi-phase, and the phases were, in a sense, the toll gates. So I don't know if kind of you all have that ability to do that, but that's kind of what our thinking was in establishing a multi-phase grant process, but also being really clear about the toll gates. And we had to develop a lot of the tools. So all of our speakers talked about different templates and things like that. So we had to develop those as part of our technical assistance work with our contractors and at the federal level to be able to look at some of these things before we kind of moved grantees through the toll gates. I don't know if any of you want to add to that.
Yeah, I just think building it into the structure of the funding announcement, it takes longer to do this. It's easier to write a funding announcement that says, to grantees, you have 4 years and you need to have a rigorous evaluation of your program. But and I think it's this may be different for other systems, but certainly within child welfare, that can't be done well or sensibly, because too many of the grantees really are having to build from the ground up, and as we both showed with our timelines, it simply takes longer than you think it's going to, and it doesn't make sense. It just doesn't make sense until you know what you're working with. If it's a replication of an evidence-based intervention is one thing, but for the most part, when it's an innovative intervention, it doesn't make sense to come out asking for a summative evaluation. The programs need to prove their worth, the concepts and the logic model and theory of change behind it really has to be put to the test before you know whether it's right for summative evaluation. And it certainly is helpful to grantees if the funding announcement they are responding to acknowledges that and sets things up for them to be able to proceed that way.
I think the other thing that I would add is that both with PI and with YAR, one of the things that we've learned and that the grantees have been very fortunate about is that they need support to be able to do this work. Getting the program staff and the evaluator staff to be able to talk to each other and ask each other the questions that they need to ask each other can be really difficult. And having a liaison, a TA liaison from the outside that can come in and say, come on guys, like, is this really your critical intervention? And that kind of stuff can really help. So I think it's more giving them the supports they need to make those toll gates is also an important thing to consider.
I was just going to add, I think in at least one PI site, I know foundations were involved in the original needs assessment to sort of get them ready to apply, you know, that they were to really establish the need, because we've all talked about stakeholders. So they needed to get everybody on board, not just that we were trying to get some money from the federal government, but here's the need. And so the foundations were at least involved in one site and helping with that. Can I ask a question to the audience?
Sure.
One of the underlying themes was, or one is an underlying, we've all talked about the amount of time it takes to do this. And underlying, you probably heard it's also very expensive. So expensive and a long time. I was just curious about the implications for Family First, where we're heading toward moving the need for more evidence-based practices, what you're all thinking, how you sort of, what's your messaging on that? How are they going to align? Where's that? Still a couple more paragraphs we would like to write, so we haven't quite figured out. So thanks a lot.
Any other questions?
I have a question. Cindy Lamy from Slingshot Memphis. It sounds like the formative assessment part was very process-oriented, and I'm just wondering the extent to which you were able to include any kind of child outcomes, even early child outcomes, in that part, because it seems like fidelity to a model that is not proven to have outcomes is sort of strange. And anyway, that's the question.
Yeah. No, that's very true. So so we should say in PI, the formative evaluation was explicitly an early look at outcomes. So you know, all the different grantees were looking to improve the same long-term outcome, which was permanency, reduction in long-term foster care. But they all had, because they had different populations of interest in different interventions, they had different logical paths for how to get there. And so there were a host, for all of them, there were a host of proximal outcomes, and that's what we were looking at in the formative evaluation. We were looking at the earliest outcomes just to see if they were trending in the right direction. So yes, that really is explicitly one of the things that was a decision point for whether the toll gate was lifted for them. If we saw no evidence that things were moving in the right direction, it makes you question, well, why would you go and do a summative evaluation? But for the second half of what you're asking, absolutely. We went around and around about the idea of, well, how are you supposed to have fidelity indicators for, how do you develop fidelity indicators for an innovative project? And it is a bit like the metaphor we used all the time, like building the plane while you're flying it. But I think it was an iterative process. We had, we were working with the grantees, particularly the implementation support technical assistance providers. We're working with the grantees to identify the really core components of the program as they saw it based on their theories of change. But ultimately, what becomes of these interventions as they are tested in sometimes multiple iterations of formative evaluation and maybe eventually with summative would be a set of fidelity indicators that are likely very different than what they thought they would be at this earlier phase that we're describing. You have to say what you think are the important components of your project in order to make sense of what the components of the project should be. And they're included because you think they're important. So by default, they are sort of the indicators of where you should be looking for fidelity. But ultimately, what really matters and what should be your set of fidelity indicators, you can't know until you've gone through summative evaluation. So I think you have to sort of start with something, but what those important things are probably changes over time. Yeah.
So with YAR and their formative evaluation, we've made it very clear to them that they need to have process research questions and they need to have outcome research questions as a part of their formative evaluation. One of the nice things about the extra year that they have is that many of them were facing a formative evaluation that was going to be maybe 6 months if we were lucky. And so trying to come up with outcomes that they can move in 6 months was tough. So now they've got more time to be able to do that. But really trying to get them to recognize both of those pieces are important. And then related to fidelity, 4 of the YAR grantees are building their interventions pretty much from scratch, and 2 of them are adapting existing interventions to fit into a child welfare system. So they really don't have any sense of what fidelity could be. And so what we're trying to get them to do in their formative evaluation is just what Heidi said. What do you think is important that needs to happen, and how are you going to measure that? And we're going to try to get them to measure some of that, and they may find that those measures are actually not what they should be measuring, that they need to think about something else. But trying to make them think about that. We've had really interesting conversations about the fact that you cannot expect homelessness to change in 6 months, particularly if the child is still in care. And so how do we back that up to something that's reasonable to look at?
Yeah, and in PI we really had a mix. We had some grantees that were implementing evidence-based practices, who were working with a purveyor who had brought them a set of fidelity indicators. And so for them, that was included in their formative evaluation. And for the other ones that were being more innovative, we weren't really talking about it as a fidelity measure so much as looking at the core components of the intervention to see are things, are kids moving from initial intake to the first assessment in as many days as you were hoping that they would? Are people being trained at the levels that you hoped they would? And you don't know if those are the important things, but we weren't really calling them fidelity indicators so much as just program functioning indicators.
Okay, well, I'd like to thank everyone for participating in our session today and thank our presenters. Just